No stomach pain, appetite improved, weight has gained. I give her arsenic album 1 m 1 dose. COVID starts in March and she has no pain, so she stops the follow up. And it is till 2025. I often see her grandmother coming to me, and there are no pains. She is absolutely fine. They did this investigation in 2020 again. You see, it was 4.9 gallstone in a 3-year-old child. And then they did this after few months. I don't remember how many months back, but it says there is no evidence of gallstones. And I had completely forgotten about this till I had to make some presentations. I said, okay, this is a wonderful case. It was very satisfying for me to see that gallstones are, first of all, to see gallstone in a 3-year-old and then no gallstone with arsenic album was something which was very satisfying for me. She is improving, then why you increase the potency to 1 m? So, of course, if we go by classical homeopathy, fifth edition, precisely if I have to tell you, fifth edition, Hahnemann says you give the remedy, wait for it to act. When the action stops, then you repeat the remedy in the same potency once, which is also advocated by Kent. And if that remedy does not work, then go higher. In this particular case, as you see that I have solved this case using polarity analysis. Polarity analysis is developed by Dr. Heiner Freiser, and according to his experience, he says that with each subsequent improving follow-up, he gives patient one potency higher in order to fasten the process of cure. Now, there could be a little bit of debate on this, that whether to wait or whether to repeat. That's a different story. At that time, I was largely following whatever he said, and I used to do that. Now I decide whether to repeat the remedy when the patient is improving or the condition needs that it should be given saclac. So that is a matter of choice depending upon the condition of the patient, depending upon the pathology, depending upon the maintaining cause, and depending upon the progressive nature of the pathology. So I use these 4 or 5 criteria to decide whether to repeat or whether to wait. Do I answer your question, Dr. Madhvi? Okay, great. And this is also given by Hahnemann. I don't remember aphorism. If I'm not wrong, it is 246 and 89 something, where Hahnemann says that we have to give one subsequent dose has to be in a higher dilution. So either you give the same dose in 5th dilution, 10th dilution, or you can go to 200 1m, 10m. Dr. Heiner Freiser goes to 200 1m and 10m. That's how he goes. 1m in dry also, or you give in the other song, we have this idea to give it in split dose. So you give them in 5 ml, 1 or 2 drops of an indicated potency, and tell them to take 10 drops twice a day for 2 days. This is what something as 1 dose, split dose. Generally, I don't give dry form somehow. Okay, now this is a case where the child cannot speak. 10 months, came with the complaint of recurrent cold and cough, has been on antibiotics for 4 to 5 times in 10 months, which of course cannot be tolerated by anyone. So my first doubt is whether the vaccination has caused this. If you remember that slide on case taking, modern drugs and its effects are very serious and severe. So in children, most important is to rule out whether the vaccination is the cause. Jan was given a vaccine, and then after 4 days he develops cold. So probably vaccination could be one of the factors. He makes an eye contact with me and maintains. This is important that we should see whether the child is having an eye contact with increasing cases of autism. If you are able to diagnose autism early before 2 years, then the chances with homeopathic medicines are very bright, very, very bright. If we diagnose it after 3, 4, 5 years, then the chances go down. When I saw him, the patient, was very restless, this child, and the mother had to constantly kind of fidget with the child because he was moving a lot. How does the journey of the sickness happen? He develops cold, then cough, and then fever, and then icy cold palms, and the body is warm. Unfortunately, the patient's parents and the caretaker could not observe any modality. So that was a challenge for us. Maternal grandfather diabetes, maternal grandmother blood pressure, hypothyroidism, and TB. Paternal grandfather, you see diabetes and hypertension, then paternal grandmother is hypothyroid. So there is a strong history of thyroid in the family. The speed of having breast milk is medium. Mother says he likes fruits, so maybe you can assume whether he likes sweets. Food allergies, nothing that they have observed. Thirstless, hot. He wets the pillow, scalp is wet. Four important remedies for these are, make a note of it. It is Calcarea carb, Sanicula, Mac carb, and Silicia. Head sweats. I heard Professor Vithalka say in one of his lectures that if he sees a child who sweats at the occiput, more often than not, it is a Calcarea child. This is how he emphasized about Calcarea, because you see, he must have seen Calcarea carb hundreds of times. And this is where I want you to, you know, bring attention to notice, especially for those who are beginners in college. With so much of online homeopathy coming, there are, with all due respects to everyone, there are uh, beginners, you can say beginners in practice, who tend to share their knowledge about homeopathy on social platform, and this is where the beginner student gets influenced. And I want that the beginner should choose their teachers very carefully. See, when Dr. Professor Vittal Kos or someone like Shankaran sir or Jayesha sir says that they have seen hundreds of cases of Calcarea carb, and in hundreds of cases they see that desire for eggs is very prominent. They have seen that they are constipated and the child wets the pillow. Now this kind of information, when someone of that stature speaks, then it comes out of an experience which has been verified multiple